more men over the age of 40 suffer from pee problems, ranging from difficulty getting started to a frequent urge to come, particularly at night time. Fortunately, there is now a simple and effective treatment. New once-a-day FloMax Relief can ease all of these symptoms within 1 week. Ask your pharmacist for FloMax Relief and take control of your annoying pee problems.
So what are these pee problems? Collectively, they're known as LUTs, or lower urinary tract symptoms. And while the commercial makes light of it, imagine getting up to go to the bathroom 5 times a night, or planning your day around where you're going to go to the bathroom. But unfortunately, that's the reality for 96% of men over the age of 65 in the United States. It gets so bad that 46% seek medical treatment. But there's also a big amount of money that's spent on this, $16 billion annually. I have some good news in that there's solutions to this. However, it's tough for the doctors to understand what's causing these pee problems. Is it the prostate enlarging and cutting off the sphincter? That's called BPH. Is it overactivity? That's when the bladder spasms. That's called overactive bladder. It's a combo of those things because one can lead to the other. Or is it something serious like cancer or neurogenic issues? Well, how do they determine this? The patient has some symptoms. They go see their doctor. They take their history. They'll do some survey that's specific to these pee problems, and then they'll do some urinalysis. Then, what they tend to do is prescribe medication to work as a diagnostic tool. So, hey, I'm going to stick this, see if it works. If it doesn't, we'll try some other medication. That's kind of backwards. Or they watch and wait. Sometimes they get their urologist involved, who does some of the same stuff. But they also have some more advanced tests. Way down the cycle of care, they have this gold standard urodynamics test that can tell them, is this a blockage, BPH, or overactivity, OAB. But even then, it only gets used about 11% of the time because it's costly and patients get embarrassed by it. You're sticking a catheter in the urethra and into the rectum. Urologists too use medication to treat, but sometimes they use that as a diagnostic tool. Last resort is surgery, but I'm here to tell you that this is completely backwards. What I want to do is take a new technology, replace that urodynamics, get that definitive diagnosis before any medication is prescribed. So what am I proposing? It's a web or mobile app. The doctor will be the user, but there are other stakeholders here, namely healthcare provider networks who are spending a lot of money and wasting a lot of money on these medications used to diagnose instead of treat. What is the doctor going to use? How is he going to do it? He's going to do the same thing that he normally does, but then he's going to put it into our program. So he'll take the age, he'll take the symptom index, how bad is it? He'll do the urinalysis, he'll put those results into this app, and then it will spit out, are you obstructive or are you overactive bladder? And how we're going to get this developed is we're going to work with some strategic partners, those healthcare networks that we talked about. I got a meeting this weekend with one of them in the area, and they're very excited to provide the data to build the algorithm that would be the meat behind this proposed solution. Then we go through the FDA through a 510(k) pathway. It's a diagnostic tool, so it would be a Class 2 device. Then, for the physicians to want to use this, they would need to see clinical trial for validation. I talked some big numbers, the 16 billion. But what is it for our region, our area? At UPMC, which has about 55% of the market share in Pittsburgh, or in the surrounding western Pennsylvania, there are about 78,000 men a year that seek treatment. 58% of them get this medication as the diagnostic tool, but they get it wrong 20% of the time for BPH and 60% of the time for OAB. So that leaves us with about 18,000 men that they're misdiagnosed. That costs, based upon the drugs for BPH and OAB, between $800,000 and $3.5 million just going down the toilet. So if we're able to, with our app, improve the diagnosis of BPH by 5% and the way that it would work is we'd contact health systems like UPMC that have insurance and hospital systems and urologists, they would purchase the app. It would be about $1 per use, or not $1 per use. Yeah, $1 per use. And like I'm saying, we could save them of that 3.5 million. If we get it right, we can save them about 1.1 million. So if they're going $1 per use, that's 78,000 men, then we would pocket the $78,000, but then they would end up saving 1.1 million. The drug companies, potentially the urologists, but the urologists that I spoke to, they want to do what's best for their patient. This would be a huge improvement for the patient because they don't have the embarrassing urodynamics that they have to go through, and they get a solution sooner, so they don't have to wait the 3 months for the drugs to start working. So the doctors want to do right by their patients, even though it might mean they have less visits and so forth. But if they're in a health system like UPMC, they're going to be concerned with the bottom line and saving the money.
Who specifically has the knowledge you need for the algorithm and how confident are you that it can be coded in the software?
So I'm a biomedical engineer, and I've developed, not for this type of predictive algorithm, for tires before, but not in this setting. I would need some bioinformatics experts, and that could be part of the partnership with UPMC. The meeting that I have in the next couple of weeks is with the VP of Data Management, and there's team members that could come from there. I was hoping to maybe bring other experts in this weekend, but I was unable to.
One last question, judges?
Do you have a sense of the time and cost of development to get this through and through the market?
It would be more minimal than other medical devices because there would be less testing. Like that, the regulatory hurdle is a big chunk of that development cost. I don't have a hard number, but because it's an app and not a physical device, and the prototyping would be much cheaper. The things that I'm familiar with, I have 5 years experience at J&J, and I worked on a lot of different medical devices. It'd be much cheaper than those.
Give it up for FloMetric.